Greetings from the Indian Journal of Anaesthesia. I, Dr. Rohin June, will present a guest editorial published in the June 2024 issue of the Indian Journal of Anaesthesia. The editorial is titled Induction Agents for Emergency Airway Management in Critically Ill Patients. This editorial is by Asad, Khawaja and Kunal Karamchandani. Asad Khawaja is from Department of Anesthesiology and Pain Management, University of Texas Southwestern Medical School, Dallas, Texas, USA. Kunal Karamchandani is from Division of Critical Care Medicine, Department of Anesthesiology and Pain Management, University of Texas Southwestern Medical Center, Dallas, Texas, USA. Emergency airway management in critically ill patients is an important component of patient care that has significant impact on the patient outcomes. It involves anatomic, logistical, and physiological challenges or a combination of these. The presence of a physiologically difficult airway predisposes to the higher risk of complications during tracheal intubation and initiation of positive pressure ventilation. A combination of factors such as sympatholysis due to anesthesia induction drugs, increased intrathoracic pressure when converting with positive pressure ventilation, amelioration of hypoxemia and hypercapnia associated sympathetic drive predispose these patients to hemodynamic collapse during tracheal intubation. An international observational study on tracheal intubation practice in critically ill patients, that is INTUBE study, reported that 45% of critically ill patients develop major peri-intubation adverse event, of which cardiovascular complications are the most common. The choice of the induction agent is a modifiable cause of patient morbidity and mortality. Numerous induction agents have been used for tracheal intubation in critically ill patients. Some of the drugs include propofol, etomidate, ketamine, benzodiazepines, and admixture drugs such as ketofol, which is a combination of ketamine and propofol, and propatate, a combination of propofol and etomidate. Propofol is the most widely used induction agent globally. Significant heterogeneity is reported in association between the propofol use and relevant clinical outcomes during emergency airway management in critically ill patients. A secondary analysis of INTUBE study findings showed that propofol administration was the only independent risk factor for hemodynamic collapse, with an odds ratio of 1.23. However, another retrospective cohort study comparing propofol, ketamine, and etomidate for tracheal intubation in critically ill patients showed that propofol use was associated with better outcomes. Etomidate and ketamine afford higher hemodynamic stability when compared to propofol, but various reports have shown mixed results. A major concern with the use of etomidate is its inhibition of 11-beta hydroxylase, which can lead to adrenal suppression. However, there is no evidence that says that this has an impact on the clinical outcomes, although caution needs to be exercised in septic shock patients. There is an ambiguity over the superiority of etomidate or ketamine during emergency airway management in critically ill patients, and the choice depends on the provider preference and the physiological profile of the patient. Benzodiazepines can be used by themselves or in combination with other agents such as ketamine. It has been associated with an increased risk of delirium, ICU and hospital length of stays, and increased healthcare costs. So the use in emergency airway management requires studies which compare the outcomes between the use of benzodiazepines and other hypnotic drugs. So, ketofol has been proposed as an ideal induction drug for tracheal intubation in physiologically difficult airway. The advantages include minimal impact on the hemodynamics, analgesic properties, thereby reduced need for additional sedatives such as fentanyl and midazolam, can be used in patients with or having high likelihood of adrenal insufficiency. However, the concerns are it requires mixing of two drugs in a ratio that may not be standardized or pre-mixed. The concentration of these two drugs in this admixture may not be consistent. Non-availability of pre-mixed formulation and limited evidence that is available at present. The admixture of propofol and etomidate, propofol, is an alternative induction agent that has been proposed to be used in the emergency airway management in critically ill patients. The advantage is better hemodynamic profile and the transient adrenal suppression that is associated with etomidate is less with this mixture. However, the safety and efficacy data is scarce. A systematic review and meta-analysis on the use of this admixture for sedation and gastroscopy showed a favorable hemodynamic stability. The propofol and etomidate admixtures comparison trial is currently underway to evaluate different ratios of these two induction drugs in the admixture. So to conclude, currently, there is no specific anesthesia induction drug that can be considered the most appropriate for emergency airway management in patients with physiologically difficult airway. Further, randomized controlled trials are required to help the clinicians choose the ideal induction agent for a particular patient and situation so as to improve the outcomes during emergency airway management in critically ill patients. Thank you.